Did you know that colon cancer rates are skyrocketing, even among younger people? It's no longer just a concern for those over 50. In fact, colon cancer is now the third most diagnosed cancer worldwide and the second leading cause of cancer-related deaths. The scariest part? Many people miss the early warning signs, and by the time they notice symptoms, it may already be too late. But here's the good news: early detection can save lives, and there are proven ways to reduce your risk naturally. In today's video, we'll break down the critical symptoms you should never ignore, the biggest risk factors, and most importantly, how to protect yourself and your loved ones. Stick with me until the end, because this information could literally save your life. Let's get started. How colon cancer develops and early warning signs. Colon cancer doesn't appear overnight. It typically starts as small, harmless polyps in the lining of your intestine. At first, these polyps are completely benign and cause no symptoms at all. But over time, sometimes over the course of several years, certain types of polyps can slowly turn cancerous. The danger is that during this silent phase, the disease can continue to grow unnoticed. By the time symptoms appear, the cancer may already be in an advanced stage, making treatment more challenging. So, who is most at risk? While age is a major factor, with most cases occurring in people over 45 or 50, younger individuals are increasingly being diagnosed. If you have a family history of colon cancer, your risk is even higher, and you may need to start screening earlier. But genetics aren't the only concern; your lifestyle plays a huge role too. A diet high in processed foods and red meat, combined with obesity, smoking, alcohol consumption, and a sedentary lifestyle, can significantly raise your risk. The key to beating colon cancer is catching it early. The best way to do that? Regular colonoscopies and stool tests. A colonoscopy can detect and remove polyps before they turn cancerous, while a stool test can identify hidden blood, a potential warning sign of colon cancer. Another early red flag is iron deficiency anemia. If you're feeling weak, pale, and constantly fatigued, it could be due to slow, internal bleeding from a developing tumor. Colon cancer is often called a silent killer, but it doesn't have to be. Pay attention to the warning signs, know your risk factors, and take action early. It could literally save your life. Recognizing symptoms of colon cancer. Early stage symptoms, often ignored. One of the biggest dangers of colon cancer is that early symptoms are often mild or mistaken for common digestive issues, leading many people to ignore them. However, recognizing these warning signs could mean the difference between early detection and a late-stage diagnosis. One of the first signs to watch for is a change in bowel habits. If you suddenly experience persistent constipation or diarrhea that lasts for weeks, it's time to pay attention. Another red flag is narrow, ribbon-like stools, which can happen when a tumor partially blocks the intestine. Some people may also experience alternating diarrhea and constipation, a symptom that often goes unnoticed or is brushed off as stress-related. Another crucial sign is unexplained weight loss. If you're losing weight without changing your diet or exercise routine, it could be a sign that your body is fighting an internal battle. Mild abdominal discomfort, bloating, or a constant feeling of fullness can also indicate something more serious. Many people mistake these symptoms for gas, irritable bowel syndrome, IBS, or just an upset stomach, but if they persist, they shouldn't be ignored. If any of these symptoms sound familiar and last for more than a few weeks, it's important to talk to your doctor. Catching colon cancer early saves lives. Symptoms of advanced colon cancer. As colon cancer progresses, symptoms become more severe and harder to ignore. One of the most alarming signs is blood in the stool. This can appear as bright red blood, which usually indicates bleeding in the lower part of the colon, or dark, tarry stools, which suggests bleeding from higher up in the digestive tract. If you notice blood, even occasionally, it's crucial to get checked immediately. Another major symptom is severe constipation or intestinal obstruction. This is especially common with left-sided colon cancer, where the stool is more solid, and tumors can create a physical blockage. When this happens, people may experience painful bloating, cramping, and a constant feeling of fullness, often mistaken for indigestion or a stomach bug. Excessive gas buildup due to blockages can also cause significant discomfort. If the cancer spreads beyond the colon, symptoms can become even more serious. Liver involvement may lead to jaundice, yellowing of the skin and eyes, liver pain, and swelling. If the lungs are affected, a person may develop shortness of breath, a chronic cough, or even chest pain. When cancer reaches the bones, it can cause persistent pain, weakness, and increased risk of fractures. At this stage, early intervention is no longer an option, but treatments can still help manage the disease. If you or a loved one are experiencing these symptoms, don't wait. Seek medical attention immediately. What causes colon cancer? Risk factors and triggers. Many people believe that colon cancer is purely genetic, but the truth is, only about 5 to 10% of cases are inherited. While having a family history of colon cancer does increase your risk, your lifestyle and environment play a much larger role in determining whether or not you develop the disease. Think of it this way: genes may load the gun, but lifestyle choices pull the trigger. Studies show that diet, physical activity, weight, and gut health are far more influential in colon cancer risk than genetics alone. This means that even if you don't have a family history of colon cancer, you're not in the clear, but it also means you have the power to significantly reduce your risk through healthier choices. A poor diet, high in processed foods and low in fiber, creates chronic inflammation in the gut, making it easier for cancerous growths to develop. Obesity, smoking, alcohol consumption, and a sedentary lifestyle also contribute to increased risk. Additionally, exposure to environmental toxins, excessive red meat consumption, and gut microbiome imbalances can accelerate polyp formation, which may eventually turn into cancer. The good news is most cases of colon cancer are preventable. By making better dietary choices, staying active, and avoiding known risk factors, you can take control of your health and lower your chances of developing this disease. Lifestyle and dietary risks of colon cancer. Your diet and lifestyle choices play a critical role in determining your risk for colon cancer. A poor diet, one that is high in processed and red meats, low in fiber, and filled with ultra-processed foods, creates the perfect environment for cancer to develop. Processed meats like bacon, sausages, hot dogs, and deli meats contain preservatives and nitrates, which have been classified as carcinogenic by the World Health Organization, WHO. Similarly, consuming large amounts of red meats like beef and pork has been linked to a higher risk of colorectal cancer. Additionally, ultra-processed foods such as fast food, sugary drinks, packaged snacks, and refined carbs promote inflammation and disrupt gut health. A low-fiber diet further contributes to this by slowing digestion, increasing constipation, and allowing harmful bacteria to thrive in the colon. Healthy gut bacteria, microbiome, play a crucial role in maintaining intestinal health, but when the gut microbiome is imbalanced, it can promote cancerous changes in cells. Obesity and a sedentary lifestyle are also major risk factors. Excess body fat produces chronic inflammation, which increases the likelihood of abnormal cell growth. Conditions like IBS, Crohn's disease, and colitis, all linked to inflammation, can further elevate colon cancer risk. Additionally, smoking and excessive alcohol consumption are well-known carcinogens that damage the intestinal lining and increase the risk of tumor development. Poor dietary and lifestyle habits fuel cancer growth, but the right changes can also help prevent it. Making healthier choices today can dramatically reduce your risk of colon cancer and improve your overall well-being. How to prevent colon cancer naturally. Preventing colon cancer naturally starts with nourishing your body with the right foods and supporting your gut health. A well-balanced diet filled with fiber-rich, anti-inflammatory, and antioxidant-packed foods can significantly lower your risk by improving digestion, reducing inflammation, and supporting healthy cell function. One of the most important dietary factors in colon cancer prevention is fiber. Eating whole grains, fresh fruits, vegetables, and legumes promotes regular bowel movements and helps flush toxins from the digestive tract. In particular, cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain powerful cancer-fighting compounds that help eliminate harmful substances before they cause damage. Turmeric, a well-known anti-inflammatory and antioxidant-rich spice, has been shown to help reduce cancer cell growth. Incorporating omega-3 fats from sources like salmon, flax seeds, and walnuts can further help combat inflammation in the body. Additionally, nuts and seeds, such as almonds, pumpkin seeds, chia, and flax seeds, are excellent for gut health, providing fiber and essential nutrients. Staying hydrated is crucial for digestive health. Drinking plenty of water keeps your intestines functioning smoothly and prevents constipation, which can contribute to toxin buildup. Additionally, maintaining a healthy gut microbiome is key to cancer prevention. Probiotic-rich foods like yogurt, kimchi, and sauerkraut support good bacteria in the gut, helping to maintain a balanced digestive system and reduce cancer risk. By making these dietary changes part of your daily routine, you can take control of your health and significantly reduce your risk of colon cancer naturally. Healthy lifestyle choices to reduce cancer risk. In addition to a nutritious diet, making the right lifestyle choices can significantly lower your risk of colon cancer. Small, consistent habits can have a huge impact on your overall health and cancer prevention. Regular exercise is one of the most effective ways to protect against colon cancer. Physical activity helps reduce inflammation, regulate digestion, and improve gut motility, ensuring that waste moves through the intestines efficiently. Even moderate activities like walking, yoga, or cycling can help keep your digestive system healthy and lower your cancer risk. Maintaining a healthy weight is equally important. Excess body fat, especially around the abdomen, is linked to higher inflammation levels, which can increase the likelihood of abnormal cell growth in the colon. Studies show that people who are overweight or obese have a significantly higher risk of developing colorectal cancer. Limiting alcohol and quitting smoking are also crucial steps in cancer prevention. Excessive alcohol consumption increases the production of harmful toxins in the colon, while smoking exposes your digestive system to carcinogens that can lead to tumor formation. Cutting back on alcohol and eliminating smoking can greatly improve long-term health. Finally, quality sleep and stress management play a bigger role in cancer prevention than many people realize. Chronic stress and poor sleep weaken the immune system, making it harder for the body to fight off inflammation and abnormal cell growth. Prioritizing good sleep hygiene, relaxation techniques, and mindfulness practices can support overall health and further reduce your risk. By incorporating these healthy lifestyle habits into your daily routine, you can strengthen your body's natural defenses and significantly lower your chances of developing colon cancer. Colonoscopy, the best early detection tool. A colonoscopy is the most effective screening tool for detecting and preventing colon cancer. This minimally invasive procedure involves inserting a thin, flexible tube with a tiny camera into the intestine to check for abnormalities. It allows doctors to visualize the entire colon, detect polyps, and remove them before they turn cancerous, making it a powerful tool for both prevention and early detection. So, who should get a colonoscopy? Everyone aged 45 to 50 and older should have a routine colonoscopy every 10 years. However, if you have a family history of colon cancer, your doctor may recommend starting screenings earlier. High-risk individuals, such as those with inflammatory bowel disease, IBD, or a history of polyps, may also need more frequent screenings. Many people worry about the discomfort of the procedure, but the reality is that colonoscopy is painless. It's performed under sedation, meaning most patients don't feel a thing and often don't even remember the procedure. The risks are very low, with complications occurring in only 1 to 2 cases per 1,000 procedures. Regular colonoscopies can save lives by detecting cancer early when it's most treatable. If you're in the recommended age group or have risk factors, don't wait, schedule your screening today. Early detection could mean the difference between life and death. Colon cancer is one of the most preventable and treatable cancers, but only if it's caught early. By recognizing the warning signs, making smart lifestyle choices, and prioritizing regular screenings like colonoscopies, you can significantly lower your risk and even prevent this disease altogether. Remember, your diet, exercise, and daily habits matter more than genetics. Now, it's time to take action. Share this video with your friends and family, because this information could save a life. If you found this helpful, hit the subscribe button for more life-saving health insights. Have any questions or personal experiences? Drop a comment below, your story might help someone else. Stay informed, stay proactive, and let's fight colon cancer together. Thanks for watching, and take care.